between PAHO and I'm the Inter-American Development Bank. My name is Miguel Amezquita, and today I will have the pleasure of being the moderator for today's session. In this webinar, the Pan American Organization, PAHO, and the IDB are creating synergies to joint effort, how to ensure products with high quality and efficiency as access to broad and access to medication, generic biological and biosimilar medication and everything that has to do with the region. So we're going to address presentations that are going to go over this series of criteria that should be had so that we can ensure quality, the region gaps that may be happening, but also the different opportunities, both in tools and in technical cooperation strategies that all different organizations are going to be using for this. So I would like to invite everyone to open this meeting. I would like to invite Alexander Legruber. Alexander is the interim director of the Unit for Access to Medication and Healthcare Technologies. He's also a regional advisor in everything that has to do with the assessment of healthcare technologies at PAHO. With more than 14 years of experience in PAHO, he has driven strategies to improve equitable access to medication and healthcare technologies, fostering cooperation between countries, and the training establishment network at Redetza. And before, he worked for more than a decade in the National Healthcare Surveillance Agency, Anvisa, in Brazil, where he was responsible for everything that has to do with the economic assessment, healthcare technologies assessment. Alexandre is an engineer. He has a master's degree in public health with a strong training in healthcare policies and economic assessment. And his track record has allowed him to combine technical and strategic knowledge to support countries in these efforts. Thank you very much, Miguel. Warm greetings to everyone here that has participated here with us in this webinar. And thank you. And obviously, this is an opportunity that's really amazing. Actually, we had an opportunity to have a joint webinar, and I would just like to thank um, everyone here, the Pamela Góngora, Alexandra Mata, Pamela Góngora, Javier Guzman, that's been sharing the space with us. But I also wanted to thank my team here at PAHO, Juliano Miguel Amezquita, he's here with us as a moderator, Mr. Lafuente, Matias Sodor, Fernando Leiza, Alisech Nunez. They're supporting us here for everything that has to do with the logistics of this event. And thank you, Alexandra Marta, that she's joining us as a panelist, and to all our team here at PAHO, the Strategic Fund. So we are deeply thankful for this opportunity of sharing with you this important discussion. In certain way, this is just a preparation for the meeting we're going to have in very few days. The first days of December, next week actually, in Uruguay. And obviously, we're going to be having our regional meeting on biosimilar mechanisms. So part of the discussion today is going to be part of the discussion with the member states in this meeting. So I would just wanted to give you a warm welcome to this webinar to see opportunities of biological medication and biosimilars. Once again, thank you very much for the participation, for the quality and efficiency of access to broad access, challenges, and opportunities. As you know, technologists for everything that has to do with new medication, biosimilars, vaccinations, etc. And medical devices have a significant impact in public health and financial sustainability. The lack of access, as we know, affects different factors. It affects competition, self-sufficiency, poor regulations for an ever-growing population that has very few information on the process of the decision making. Also, we're related to everything that has to do with public expenditure is really important. So a recent study of PAHO, the recent studies in medication was the most important expense that is between 48 and
Você,
74%
obviamente, está
depending on the country.
aumentando o risco de
So
iniquidade e
increasing the risk
exclusão,
of inequalities and
especialmente
exclusion,
nas populações
and
mais vulneráveis.
especially in the most vulnerable
Vemos também
populations.
brechas
We also
estruturais
see
em
structural
biossimulação em
gaps
produtos farmacêuticos, importações,
for
quintuplicando
pharmaceutical
as
products and imports that
exportações da região,
are
uma fragmentação dos mecanismos de
fivefolding the
compra e
exports in the
também
region,
falta de
and a poor mechanism
transparência em
of
relação a
purchase and lack
preços
of
dos
transparency
medicamentos.
of
Como mencionei
medication
anteriormente,
prices.
uma
As I
crescente
mentioned before, an
judicialização no
ever-growing
acesso, na incorporação de novas
lack of
tecnologias
access
nos
in
sistemas de
bringing of
saúde.
technologies
Alguns
to
dados
healthcare
realmente impressionantes,
systems. Some
para mencionar alguns
states have
exemplos:
made
Brasil,
amazing
Colômbia,
effort. For example,
Costa Rica,
Brazil, Colombia,
vimos
Costa Rica.
incrementos que variam
We
entre
saw increase that chain between
120% e mais de
$120
140%
and
na última década,
140% over the
elevando uma
last decade,
enorme pressão
creating a
sobre os
huge
pressupostos do plano de
impact
saúde.
on the public healthcare
Justamente
budgets,
por esta grande
precisely
preocupação e esta
because of this
prioridade que
huge
se tem nas
concern
agendas
and this
políticas dos
priority
países.
in the political agendas of the
Recentemente, faz
countries.
pouco hora,
Just
na primeira
recently, a
semana de outubro
few
deste ano,
days ago,
os
actually the
Estados
first week of
membros da
October
OPS
this year, the member
aprovaram
states
a
of PAHO
política regional
approved
para
the
ampliar o
regional
acesso
policy to
equitativo à
broaden
tecnologias sanitárias de
equitable
alto
access
custo e de
to
alto preço.
healthcare
A
technology
resolução
of high
CD
price,
62 R7,
according to
que
resolution
entre suas ações prioritárias
62R7, that puts
estabelece
between
lá a
its priority
necessidade de
actions the
fortalecer as
need of
capacidades
strengthening
sosteníveis de inovação,
sustainable capacities for
investigação e
innovation,
desarrollo,
research and
melhorar os
development,
processos de
improving
avaliação,
processes
seleção
of
e
assessment,
incorporação de
selection,
tecnologias sanitárias e
onboarding
contribuir
of
ainda
healthcare
para a
technologies and
preservação.
contributing
Também,
to
muito importante,
improve
fortalecer os marcos
access. It's
regulatórios
important
e
to strengthen
melhorar a
the regulatory
competência,
framework and
fortalecendo a
improve
competência
the
de
and
mercado
strengthen the
para
competition
promover a
of the market
redução de preços,
for
fortalecer e
price
promover a
reduction
utilização dos
and
fundos
strengthening
rotatórios
the
regionais da OPS
usage
e
of the
promover a
regulatory fund of
geração e o
PAHO
uso da evidência e
and the
também o
use of
seguimento e
evidence
monitoreio da
and
utilização
follow-up and
e cada vez
monitoring
mais a generação
of
e o uso de dados
the
estratégicos
generation and the use
sobre
of strategic
tecnologias
data
sanitárias.
on healthcare
Com todo
technologies.
isto em mente,
So
OPS
taking
tem
all this into
realizado uma
account,
série de
PAHO has
atividades
been
no,
carrying out a series
como
of
parte do
activities
ciclo de discussões
as
sobre
part
a
of the
ampliação do
discussion
acesso a
cycle
tecnologias em saúde
on the
regionalmente,
broadening of
nos
access of
arrojado o
medication
tema
in the region of the
através de uma série
Americas,
de eventos,
developed
em los
through a
quais
series of
hemos
events,
discutido diferentes
which have been
temáticas,
discussing
como,
different
por
issues,
exemplo,
such as,
políticas de
for example,
preços e
price
asequibilidade, que
policies,
dissemos recentemente, fim de
accessibility,
ano passado,
and at the
ampliação
end of the
do
last year,
acesso a
the broadening
biosimilares,
of
dissemos abril de
biosimilar access that
2025,
we did
com
in June
participação e
2025
experiência de
with the
países
participation of experiences of
distintos
countries,
países como Brasil,
different countries
Chile,
like Brazil,
Equador,
Chile, Ecuador,
Canadá e Uruguai.
Canada, and
E
Uruguay.
nessa oportunidade, e nesse
So
webinar,
in that
se
opportunity,
abordará a qualidade como eixo
this
central
today we will
frente ao
address quality
desenvolvimento e
as the
implementação de
main
políticas e
development
estratégias
access
prioritárias de
for the
acesso,
implementation of strategic
dadas suas
policies to broaden access,
implicações em la
given its
generação de
implications
confiança de
in
los
the
diversos
creation of
atores ao largo
trust
do ciclo de
of
vida
all
das
different
tecnologias em
stakeholders through
saúde,
the life cycle
em
of healthcare
particular no
technologies, and
relacionado
in
com a
particular, everything that
prescrição
has
e o
related
uso
with
racional dessas
prescription and the
tecnologias.
rational use of these technologies.
Como mencionei ao princípio, estamos muito contentes
As I
nessa
mentioned at the beginning,
oportunidade de
we're really
unir
happy of
esforços, unir
putting our
forças,
effort
buscar
and
sinergias entre
join
o PS e o
forces
OPS
and look for
ainda.
synergies
Como
between
sabem, há um
the
acordo
IDB
amplo
and
de
PAHO.
colaboração
As you know,
entre as
there's a
duas
broad
instituições,
collaboration agreement between both
especificamente nos
institutions,
temas de acesso
specifically in everything
a
that has to do
tecnologias
with
sanitárias, o que
access
inclui
to
também a
healthcare
avaliação
technologies,
de
which
tecnologias.
includes obviously assessment of
Estamos
technology.
trabalhando e vamos
So we are
trabalhar
working, we're going to
juntos
keep
em
working
vários destes
together
temas. Esse
in
webinar
many of these
especificamente
issues.
permitirá
And
promover
obviously,
essas
this will
sinergias, como
allow to
mencionei,
foster
para
the
generar
synergies that I mentioned
oportunidades
to
e
create
soluções
opportunities
práticas
for
ante desafios
practical
comuns da
solutions
região das
in regards to the
Américas.
common
A
challenges that we have
ampliação do
in the
acesso
region
às
of the
tecnologias
Americas, the
sanitárias na
broadening to
região
access of these
requer
healthcare
enfoques
technologies in the region
integrados,
that want to have a
incluindo qualidade,
comprehensive approach that will combine
sustentabilidade
quality,
e equidade.
sustainability,
Ante os
and
desafios que
equality.
representam os
So in the
medicamentos
face of the
genéricos,
challenges that we
biológicos
have
e os
with
biosimilares,
generic
a
medication,
colaboração
biologically,
entre a
biosimilar, the
OPS e a BID
collaboration between
resulta
PAHO and the IDB
estratégica
turns
para
to be
articular
strategic
a
to
experiência
articulate
técnica da
the
OPS com
technical
a
experience
agenda
of
de
PAHO
eficiência da BID, que
with
em
the efficiency
conjunto
of IDB,
podem
and
orientar
that so that together they
políticas
can guide
baseadas em evidência
policies
para
based on
ampliar o
evidence to
acesso
broaden
da
the
população às
access of
tecnologias
people
sanitárias
to healthcare
em nuestra
technologies
região das
in
Américas.
our region of the
Con esto,
Americas.
una vez
So with
más,
this, once
muchas
again,
gracias.
Thank you very much for being here in this webinar. We have almost 500 attendees. We are thrilled to have that many people here with us. And once again, let me give the floor to our Master of Ceremonies, Mr. Miguel, Mr. Amezquita. Thank you, Alexandra. Let's remember to our audience that this event will be recorded in all three languages, Spanish, English, Portuguese, and obviously we have our simultaneous interpretation service. So going back to the opening issue, so Alexandra has given us that framework that with PAHO and the activity that they have been carrying out and they will carry out in the future. But we would like to have, by the IDB, some input. We'd like to have Javier Guzman is going to give us an opening and he's going to be telling us how this efficiency agenda comes together in this event and in this joint collaboration. So Javier is the director of the Healthcare, Nutrition, and Population Division of the IDB. He's an expert in global health and he has broad experience in healthcare policies, pharmaceutical systems, and regulation. He has held positions of leadership at the Center for Global Development and Management Task for Health, supporting governments of Africa, Asia, America, and Latin America. Between 2013 and 2018, he was the Deputy Director of the Assessment Agency for Healthcare Technologies, Director of Medication and Healthcare Technologies, and Director of BIME Colombia. He's a doctor with a master's in policy planning and financing at the healthcare sector, LSE, LSHTMN, and has an MBA from the Australian Graduate School of Health. Javier, the floor is yours. Thank you, Miguel. Thank you, Alexandre. It's a pleasure to be here with all of you. Welcome once again. For us, it's a pleasure to be here because, as Alexander mentioned, this collaboration between the IDB and PAHO that has been historical is at its best moment yet. It allows us to offer to our member countries strategies, solutions, and evidence-based policy solutions that can improve the access or sustainable access to medications and healthcare technologies. Okay, the first thing that I wanted to mention is that in the region, we still have healthcare access problems. The latest data shows that almost 16% of the urban centers in Latin America and 20% of rural places in America lack healthcare access. Obviously, there's a limitation in the access to medication as well. Second thing is that this is a region that is diverse and it's ever changing. Actually, we're talking about how we have seen an increase in chronic diseases and non-communicable diseases. We see an increase in technological pressure that shows that now there's more tools at our disposal, healthcare technologies that can be used for the comprehensive diagnostics of these patients, and that we have to think the best way to have sustainable access. And sustainable access means that we guarantee access, we reduce inequality, we reduce pocket spending and catastrophic expenses, but we think about the sustainability of the system in the long term. From the bank, we have been working for more than a decade in the efficiency agency. Actually, we established the criteria network, and this had as a main objective to support governments and countries in determining what to buy and at what price. And obviously, this has to do with how we can institutionalize the technologies, how to create benefit plans, how to determine payment mechanisms, etc. But right now, we want to talk about something that we have done recently, and it's a powerful tool to diagnose and facilitate the penetration of generic medication and the penetration of biosimilar medication. We think that this tool is really, really useful because it allows us to it will allow us to understand what are the main elements that determine this lack of access. You know, the region has a low penetration of biosimilars and generic medication, and it also allows us to create strategies or design strategies to be able to improve that penetration. It's the first time that we present this tool in public. Jaime and Pamela will present it, and we are quite excited and keep going the conversation with PAHO and its member states and how we can move forward in the diagnostics and the implementation of policies that will allow to improve this penetration. The second thing that we think it's important is that we had an online course to know what can we fund at what price. Pamela already put the link in the chat. It's an online free course that has a great mixture of experiences in the region, experts in the region, what has worked in the region, what has been done. And we invite every single participant to join the conversation, join the course, and benefit from it. Finally, let me close by saying that the opportunity that we have today of have a real influence in the change on how to guarantee sustainable access is a window of opportunity that we need to take advantage of, because otherwise we're going to see that with the fiscal limitations and with the technological pressure, with the difficulties of high cost diseases, we're just going to see that this problem we're going to grow and grow and get worse, and we're going to have deep problems in how to keep our healthcare system sustainable. Thank you very much, and let me get back to Miguel.
Muchas gracias, Javier.
Thank you, Javier. So we'll see how this relationship between PAHO and BIT that we hope can be long-lasting comes together to be able to create synergies in our region, in the Americas, and how we can address the need of the member states through different strategies. So I would like to start to see the presentations, thanking Alexandra and Javier for their opening remarks. And now we're going to have the upcoming presentations that we see here. First, we're going to see with Juliana Balini from PAHO, what is the situation, current situation, and access to biological medications in the region of the Americas. Obviously, we're talking about quality to broaden access, but Juliana is going to talk about those gaps that we have in our region in access to medication and healthcare technologies. And then our colleague Alexandra Mata from PAHO is going to be talking about the considerations and everything has to do with biological and biosimilar medication quality. Even though that's the point where this event starts, it's the core of this event, we would like to talk about, obviously, access as well. Now, we are going to have Pamela Góngora Salazar and Jaime Spain from the IDB. They're going to be talking about the tool for policy assessment for generic medications and biosimilars. And we're going to close the presentations by our colleague Nora Giron from PAHO, from the Regional Regulatory Fund. She's going to be talking about the overview of biosimilar and generic medications for the regulatory fund. Afterwards, obviously, we want to talk to you guys. We want to have some interactions, some Q&A, and we invite you to please drop your questions at the Q&A and at the chat to the presentation. So our panelists are going to help us so that we can have enough time to be able to answer all your questions. So with this, I would like to give the floor to Juliana Balini for her presentation. Juliana Balini is a regional advisor for everything that has to do with access policies for medication and healthcare technologies at the IMT department, or Innovation department at PAHO. In the past, she was the technical officer for the strategic fund at PAHO, and she has more than 15 years of experience in healthcare institutions in Brazil, including the National Regulatory Authority ANVISA and the Ministry of Health. And during her career, she has focused on development, implementation, and policy to improve access, availability, and accessibility to healthcare technologies and medications in the region, just as everything that had to do with intellectual property. She is a lawyer, and she has a master's degree in healthcare economy and pharmacoeconomy with the Administration University in Barcelona, and she has a master's degree in law, economics, and public policies with the Complutense de Madrid University. Juliana, so let's talk about these regional gaps and the countries in our region, and with that, we'll start our presentation. Thank you. Thank you, Miguel. Hello, everyone. It's a pleasure to be here.
Esa es una oportunidad muy especial para
This
nosotros
is a
de
really
estar con
special
David
opportunity
y
for
con
us to
todos
be here
ustedes.
with
No sé si ven
IDB, with
mi
all of
pantalla.
you. I don't know if you can see my screen.
¿Sí?
Sí, ya la vemos.
Perfecto.
Yes, we can see the
Entonces,
screen.
acá,
Perfect.
bueno,
So,
como mencionaban
as
Alejandro y
Alejandro,
Javier,
Alexandre and Javier were mentioning,
bueno, la región pasa por
the
algunos
region
desafíos y
is going
nosotros desde
through
la
a series of
OPS
challenges,
venimos
and we at
discutiendo con los
PAHO, we
países,
have
con
been
los Estados
discussing with
miembros,
all member states
basado en todas las etapas
uh,
del ciclo de vida de las
about,
tecnologías
or
y
we're
con
talking
esa
about
perspectiva
all the
de salud
stages of
pública, de
access
garantizar
to
equidad,
healthcare technologies. We need
equidad,
to guarantee
efectividad,
equality,
disponibilidad,
accessibility, availability,
accesibilidad,
etc., etc.,
cómo podríamos mejor
and how we
apoyar y
can
cuáles serían los elementos
support better
claves.
and what would be
Entonces,
the key
de una
elements.
mirada
So,
desde la
from
innovación y la
a
transferencia de
perspective of
tecnología
innovation and
hasta
knowledge transfer
el uso
until
es lo que estamos
the
proponiendo
use
en
of this
ese
medication,
trabajo
that's what we're
conjunto
proposing in this joint
y que
work,
vamos a discutir
and that we are
aquí en
going
el
to
día de
be
hoy,
discussing here
cerrando esa
today,
etapa de ciclos
closing
virtuales de ese
this
año
online webinar
acerca de los
series
medicamentos biológicos
about
genéricos y
biological
biosimilares.
medication
Este
and
año es
biosimilars.
importante decir que
So
tuvimos la
it's important
aprobación
to
de una
mention
resolución que
that
también
we had
dialoga
the
con
approval of a
estos
resolution that
elementos,
also
esos
talks
diferentes
to or
elementos de
talks about the
búsqueda de
different
ampliación de
elements
acceso de
of
manera equitativa, que fue la
broadening of
resolución
access to
para
medication in an effective
tecnologías
manner,
sanitarias de
which
alto
was
costo
this
moderno. Eso
resolution
que entró en las
that was a
capacidades
policy to
de
broaden the equitable access
investigación y
to healthcare
desarrollo,
technologies
de
for a high cost
producción,
and high price.
de evaluación y
Obviously,
selección
this is
de
it went under
medicamentos,
a review
formas de
stage,
acelerar la
talent selection,
comercialización,
and obviously
fortalecimiento de los marcos
with
regulatorios,
removing all the
fortalecimiento
red
de los
tape,
fondos europeos
strengthening regulatory
regionales de
framework, strengthening
promoción
regulatory funds, regional
de
regulatory funds,
evidencias.
and the promotion
Y
of
acá
evidence.
un
And
importante
here
punto es
we
que
want to
esas
talk about an important
perspectivas
point is
fueran
that those
traídas
perspectives were
por los
brought
países
by the countries,
no solo para los medicamentos de alto
not only
precio,
for
pero
high
como
price
cuellos de
medication,
botella que
but
tenían en
also
general lo que nos llamó
bottlenecks
mucho
that
la
they were
atención.
suffering. And this really
Entonces,
called their
para
attention.
eso
So for
desarrollamos y
that,
ya veníamos
we
trabajando, pero
had been working
profundizamos la
and we
metodología
deepened in
de
the
trabajo
technology of work.
con el análisis de los cuellos de botella
We
de
analysis
acceso
of
en los
this bottle
países
access
que
bottlenecks in the
van desde el
countries
análisis de los
that go
registros,
from
pasando por la
registry
cobertura que
analysis,
es prestada,
going
la cobertura
through the
pública del
coverage,
sistema de
the public
salud,
coverage of the healthcare
incluyendo
system,
acá los
including
diferentes subsistemas que hay en los
the different
países desde
subsystems
que
that we have
tenga
in the
ese
countries
componente público,
ever since
el
we have
análisis
this
del mercado,
component and the
el
analysis
análisis de
of
los
the market,
precios y
the
de las
analysis
formas de esas
of the
adquisiciones
prices and the
públicas
ways of
y
these
de los
public
marcos de
acquisitions
patentes en esos
and
países
the
para
patent
entonces
frameworks in
entender
those
cómo se
countries
puede
to
apoyar a
better
esos países de
understand
una
how
mejor
can we
manera
broaden these two
y
countries in
cómo
a better
podemos
way
avanzar en
and how we
acciones
can
concretas
move
que
forward in
beneficien a todos
concrete
los
actions
países de la región
that
de manera
benefit the countries in
regional
the
y también
region
de manera
in a regional
individualizada.
way and in an
Y como ya
individualized
veníamos
fashion as well.
diciendo y
And
presentando y
and
dialogando con
as
los
we have said
países, bueno, lo que
before
vemos es un
and talking to the
escenario
countries,
de muchas
this
diferencias,
is a center
de
of
muchas
a lot of
diferencias que
differences, a lot
empieza
of
con la
differences
cantidad de
that start
registros
with the amount
en la región. Cuando
of
hablamos, por
registries in the
ejemplo,
region.
de productos
For example, when we
biológicos y
talk about
biosimilares.
biological and biosimilar
Entonces, vamos a ver una
products,
variación muy grande del
um, we
número de
see a
registros, lo que
huge variation
significa
number
que
of
esa
registrations.
disponibilidad en los
And obviously,
países, en muchos
the
casos,
availability in
también va
many
a
countries is
variar
different. It's going
significativamente
to
y eso
change
vamos a ver.
significantly.
Y
And we
también de
are
la
going to see this.
importancia
And also
de la
the
competencia
importance
cuando esa
of
competencia es
competition when that
posible internamente
competition
en los
is
países.
actually
Entonces, si
possible
estamos
in the
hablando de
countries.
productos,
So
por
we are
ejemplo,
talking
de
about products like,
anticuerpos
I don't know,
monoclonales o de
mono
productos
monoclonal
de alto
antibodies
precio, de
or
productos
high price
biológicos,
products or
y ya
biological
hay la
products.
perspectiva
And
de
we
entrada
already have
de
the
medicamentos
perspective
genéricos o de medicamentos
generic medication
biosimilares,
or
lo
biosimilar
que vemos
medication,
basado en
what we see
estudios, no solo, y
based
en
upon the
análisis de datos,
studies,
no
not only
solo en
from data
países
analysis,
como
but not
Estados
only in
Unidos,
countries such as the
pero
US,
también en los países
but
de
also in
Latinoamérica y
countries of
Caribe,
Latin America
es
and
una
the
reducción
Caribbean,
bastante significativa en
is
el
a significant
precio
reduction
eh,
in
de los
price
productos que los países pueden
and the
acceder.
products that the
Entonces,
countries
lo
can
que
have
tenemos que
access to.
crear
So what
son
we have to
capacidades,
create
primero, de que esos
are
productos estén
capacity
disponibles a
for
un
people
precio
so that
asequible cuando
those products can
patentados
be
en los
available at
países
an
y,
affordable price,
posteriormente, que
and
los países
obviously
tengan la
that for the
posibilidad
countries
de,
to
así que
have the
aspiradas a esas
possibility
patentes,
of um,
la
of having
incorporación
those
de esas
patents so that they
tecnologías
can bring
biosimilares y genéricas
those
en su
biosimilar and
capacidad
generic
máxima y que
technologies
puedan
in their
reducir
maximum
los
capacity
precios y que la gente pueda
so
tener
that they can have
acceso a esos
reduced
productos. Eso
prices
es lo
and so
decía.
that people can have
Entonces
access
acá
to those products.
traímos
So
el ejemplo
here
del mercado
we're
estadounidense,
bringing the example of the American market
donde se mostró que
where
para el medicamento
it was
trastuzumab, que
proven
es un
that
medicamento
for
para cáncer de mama,
trastuzumab, which is
con la
a breast cancer
entrada
medication,
de seis
with the
productos
entry
genéricos,
of six
biosimilares en
generic
el
and
país,
biosimilar
hubo
products in the
una
country,
queda,
there was
una reducción bastante
a
significativa del precio
significant
medio de
reduction
venta del
of
producto, ¿no?
the
Entonces
average
acá eso es
price of the
importante, pero
product
también
sale. So we
replica
we
en
see
varios
how
de los
this
países del mundo.
replicates
Hay
in
también
many
un
other
tema
countries
de
of the region.
coberturas, las
There's
coberturas públicas
also
y las diferencias que
this
hay y la
coverage
falta
issue,
de
public
concordancia
coverage,
que hay
and the differences,
entre
the
lo que
lack
se está
of
proveyendo como cobertura
uh,
pública y las
matching,
recomendaciones
what's
internacionales de la
lack of balance
OMS o
between
mismo
what's
las
public
guías
coverage
de
and
prácticas
international
clínicas
recommendations
de
by
los mismos
PAHO.
países.
And
Entonces
obviously,
acá traímos un
this
ejemplo de
means
las
that we
insulinas.
brought an
El
element, for
ejemplo de
example,
las
from the United
insulinas es
Nations,
importante
a
porque
UN example,
nos muestra la variación de
because this
cobertura,
shows
una
the
cobertura
variation of
bastante
coverage,
satisfactoria en
a
el
coverage
número
that
de
is quite
países que
satisfactory
tenemos en la
in
región,
some countries in the region, for
pero
example, for
que nos
human
muestra
insulin.
también que
But
no
it's also going
necesariamente
to
esa
show that
cobertura va a
that
resultar
coverage is going to
en
translate
disponibilidad
into
y precios dependiendo
availability
del tipo de
and
mercado.
good prices
Entonces,
depending on the type
en
of the
ese
market.
caso, cuando vamos
So in this case,
en aquella
w-
línea inicial de
when we
trabajo a
go through that initial line
la
of work
asequibilidad
for
acá queremos
accessibility, well,
demostrar
we
que
want to prove and we
hay
want
una
to
diferencia
show
de precio,
that
esa diferencia
there's
que
a
estamos hablando
price
tanto para
difference.
medicamentos de síntesis
Actually, we're talking
química
about
cuanto
this
para
for
medicamentos biológicos.
um,
Importante
biological
anotar que, por
medication, and
ejemplo,
it's important to
trajimos
say
los
here
medicamentos que
that
son llamados
we
de
brought
similares en
medications that
Brasil,
are
pero
called
son de
biosimilars in
genéricos de
Brazil,
marca
but that they're
en otros
generic
tantos
in other
países.
countries.
Pero que esa variación
But
es bastante
for that
significativa en
variation is
términos de
quite
precio
significant in
entre
terms
de
of
referencia
price
y
and
los
between the reference
genéricos
price
o los biosimilares.
and
Acá
biochemical and biosimilars.
evaluando para diferentes
So
países, pero
assessing
también
this for different
considerando que
countries
en varios
and also
casos los
considering
biosimilares no
that
están
in many cases
disponibles,
biosimilars
como pueden ver
are not
ahí
available as you
en
can
el marco de
see
los medicamentos
in the
biológicos.
framework of this biological
Pero cuando
medication.
pensamos, bueno,
But when
si
we
hay
think, okay,
disponibilidad y hay
let's say that we
competencia,
have
ya está.
availability, we
No
have
es
good
verdad.
competition,
En
and that's
muchos
good enough,
casos,
but that's not
lo que
true.
estamos
In many
observando
cases, what
en los
we are
países es que para
seeing
los medicamentos biológicos hay
is
una
that for
variación
biological
bastante
medication, there
significativa
are
de los
some very
precios,
significant
más en el
variations
mundo.
of the
Y más
most
allá de eso,
important
que a
prices.
veces
And
esas
beyond that,
variaciones se
those
dan incluso
variations
internas en
happen
el
even
país.
internally in the
Entonces,
country.
en el mismo
So
país
in the
vemos
same
que
country, in the very same
adquisiciones
country,
son
we see, for
hechas
example, that
con
some
una
acquisitions
diferencia muy
are
grande.
done
¿Cuáles son
with
las
some
razones
big
de estas
differences. So what
diferencias?
are the
Pueden
reasons for
ser
those
el tema de
differences?
la
I don't know. It may
centralización o
be everything that has to do with
descentralización de las
centralization,
adquisiciones en
decentralization
diferentes países.
for
A
these
veces las
acquisitions in
cantidades
different
son muy
countries.
chicas, las
Um,
modalidades de
the
compra,
modalities
a veces va por
purchase.
trato directo, a
Sometimes
veces va
it
en un
goes
proceso
directly,
licitatorio más amplio
sometimes
y consolidado.
it
El tipo de institución que se lo
has
compra
a
y en
process
muchos casos
that
en
is way
nuestra
longer,
región,
that
como
are
comentaba
centralized,
yo sobre
decentralized.
al
But for
principio,
example, is it done
son
directly? Is it done through
medicamentos que
tendering? Is
resultan
it
de
done through hospitals, programs,
comercialización
etc.?
por
And
un
everything that
tema
has to do
de
with
que no
digitalization.
haya
For example, with
administración
the issue that
estatal o porque
there's
haya
no
una
state regulation,
exageración,
or
una
there's an exaggeration,
dignificación del uso del
and
Estado de medicamentos esenciales o de la canasta de
so, for example,
medicamentos o
uh,
de los medicamentos
there's
evaluados en
exaggeration.
términos de
There's
tecnologías sanitarias que fueron incorporadas
there's a
en el país.
process that says that the
Cuando
medication is not
vamos
what it's
evaluando y
supposed
seguimos
is not what it is,
profundizando
and is
en
not what's
esas
supposed to do
brechas de
when we're talking
precios
about
de
these
compras
technologies in the
públicas,
countries. And we talk
lo
about
que vemos es
and we
que
deepen in these gaps
en varios
in public
países, y
purchase,
acá
but we see
importante
that in
decir
many
que
countries here,
es un
and it's
ejemplo de
important to say that
insulinas,
this is just
y
an
estamos
example for
comparando algunos
insulin
países de
pens,
América
and
Latina y
we are talking
algunos
about some countries
países
in Latin
de
America
la
and some
Unión
countries
Europea.
of the European
eh,
Union.
y lo que nos sorprendió
And what we
mucho en
see,
ese análisis fue
what was
percibir
surprised us
que
in those
en
analysis
muchos
was to
casos
see that in
Latinoamérica paga
many
más caro
cases in Latin
que
America
países
pays more
europeos para el
money
mismo
than
producto.
European
Entonces,
countries
son
for the
esas
same
razones y
product.
cómo hacer para
So those
minimizar o
are the reasons.
minorar
And
y
how can we
cambiar esa
minimize
realidad
and
es que
change
queremos promocionar
the
esas
reality? And
discusiones.
that's why we want to do what we want to
Si
do.
vamos siguiendo en la ruta que habíamos
So
establecido
if we
de
go through the
diálogo
route that we had
y
established
evaluamos los
and
medicamentos
we
oncológicos,
assess
por ejemplo, ejemplo,
oncological
vamos a
medication, for
ver
example,
que en
we
la
are going
región
to see that in the
hay
region,
una situación que, por
there's
ejemplo,
a situation that,
varios medicamentos
for example, a lot
son
of medications
incorporados
are
por
brought in
maneras directas o por recursos
directly
judicializados
or with
que no traen, no
judicialized
presentan
cases
un valor
that do not present
terapéutico
a
o un
therapeutical
valor
value
terapéutico adicional añadido
additional
que represente un
that
incremento
represents
de ese precio de
an
manera
increase
significativa.
of that price in a
En
significant
varios de
fashion.
esos casos, esos
So
medicamentos
in
son
many of those
medicamentos
cases,
patentados. ¿Qué
these
significa eso?
medications are
Significa que
patent.
son
And what
medicamentos
does
que
that mean?
tienen
That means
una
that these are
situación de
medications that
monopolio
has that's suffering a
legítimo de
monopoly
20
and
años.
legitimate monopoly situation.
Acá trajimos un
So
ejemplo de ese
here
país
we brought an
para
example
mostrarles que a
to
veces
show
para
that sometimes
un grupo de medicamentos de
for a
anticuerpos
group
monoclonales acá
of,
del listado
for
de
example, monoclonal
esenciales,
medication, for example,
va en un
that's taken
creciendo,
off from the
¿verdad?
list of
Ya se
essentials, but it's
incorporó,
been
ya se
growing.
usó, pero
It
el
was
número
brought
de
in, it was
patentes para
used,
que se
but the number
amplíe ese
of
tiempo
patents
de
be,
monopolio
so we can broaden
sigue
that
en
monopoly
el
time,
tiempo.
but
Entonces,
still
eso es un
there
punto
over time.
importante y
So
acá
that's an important
trajimos
point to
el
cover.
ejemplo
And
de
here we
diabetes para que
brought the
entiendan
example of
mejor de lo que
diabetes so
estamos
you can
hablando.
understand what we're
Estamos
talking about
hablando de
better.
una
So
variación
we are
también por
talking a
país, entonces ya
variation
hablamos de variaciones
as
de
countries. So we
precio
talked
entre
about
países, de
variations of
variación de
prices
precios
between countries,
interna
price reduction,
en
etc.
los países. Y
in the
más allá de
countries.
eso, ahora estamos
But
hablando
beyond
de la
that,
variación de
we
la
are
forma de
talking
evaluar
about
esas
the
patentes,
variation
de
in a way of
concederlas,
assessing
generando
those
esos
patents
monopolios y que
by
varían para el
creating those
mismo
monopolies
producto y la
that will
misma
change
patente
for
en
the same
diferentes
product, the
países.
same patent in
Lo que es
different countries.
bastante legítimo, pero
So what's
también nos
quite
permite
legitimate too, but
profundizar
it allows us
en
to
esa
deepen
evaluación
in that
y a
assessment
partir
per
de esa,
se. And from
de esa
that
profundidad
deepening and
en que
from
se
that
evalúa cada
depth
tema,
in which we
percibir
assess
qué
each
hay y a
issue,
partir de
we
ese
need
qué
to
hay,
see
buscar
what's there. And from
estrategias
that
que
what's
puedan
there
apoyar a la
is
región y apoyar a
what can
los
we do to
países.
support the
¿Qué se
region and
quiere
support the
decir con eso?
countries?
Que hay que entender qué se
So
está
we
protegiendo,
need
de
to
qué estamos
understand
hablando,
what
por qué ese
we
precio
are
es
talking
así,
about, why
por
the
qué está
price is like that,
disponible, por qué
why
tienen
is it available like that,
desabastecimientos o no tienen
why
desabastecimientos.
do you have a
Las
lack of
empresas a
supply or
veces
not?
están
So companies
protegiendo ahí
sometimes are protecting their own
sus
interests
principios activos,
and
como
their
vemos
active
acá,
principles.
a veces
As
están
we see,
protegiendo sus dispositivos
they're
médicos
protecting
vinculados a esos principios
their
activos y
those
todo eso
principles,
tiene un
etc.
impacto en el
And
final en
obviously,
la
it has an
asequibilidad
impact
de esos
in the
productos
accessibility
por el
of those
paciente, por
products
la persona que
by the
necesita
patient or
de
by the
ese
person
producto.
that
Es
needs that
importante
product.
decir que
So
no
it's important to say
necesariamente
that not
la expiración
necessarily
de la patente, o sea, la pérdida de esa
the expiration of the
exclusividad de
patent
los
of the
20
loss of the
años
exclusivity of those
va a
20 years or
significar en
something
el caso de
is
los
going to
medicamentos
mean,
biológicos y
in the case of
biosimilares,
biological and biosimilar
una
medication, is
accesibilidad
going
más
to
grande
mean
en el mercado o
um,
un incremento
higher
necesario
accessibility
en la
in the market
competencia. ¿Por
or a
qué?
necessary
Porque
increase in
en
the
muchos
competition.
casos
Why?
en nuestra
Because in
región
many
lo que se
cases
ve
in our
es
region,
que esos
what we are
medicamentos
seeing
biosimilares no
is
están
that
disponibles en la
biosimilar medication
cantidad
is not
o en la
available
calidad
in
que
the
se necesita.
amount
Pero más
or the
allá de
quality
eso, lo
that's
que se
needed.
ve, y ese
But
estudio de
beyond that, what we
IQVIA trae
see
eso de
in
manera
that study
bastante
that we're
clara,
seeing,
es
and
que en
that study from
algunos
IQVIA was
casos
quite
los
clear, is that in
biológicos
some
pierden la
cases,
exclusividad y aún
biologicals
así no
lose
tienen
exclusivity, and
competencia y esa
even then
competencia
they
no
have no
viene porque
competition,
el
and that the
pipeline de
competition
producción
doesn't
o
come because it's not part of production
en
pipeline, for
los
example,
países no
in
está,
is not
no
prioritized in the
está
countries, basically.
suficientemente estructurado. Y acá
It's not
entra una
completely well
discusión que
structured.
también es bastante
So
relevante que
obviously,
lleva
this is a
a
discussion
los
that's
temas
quite
de
relevant.
transferencia de
That
tecnología de
comes,
producción regulada
for
y todo
example,
eso.
for everything that has
En
to do
función de eso,
with
los
this function.
países
So,
pidieran a la
in function of
OMS
that, the
y
countries
aprobaran en
asked
el marco
PAHO
de los medicamentos
and
de alto
approved to the
precio que
framework of high-price
trabajáramos
medications
y
for them
profundizáramos
to
ese
work
análisis
and
de los
deepen on that
medicamentos
analysis
biosimilares
of
y genéricos,
biosimilar medication,
que trabajáramos de manera coordinada
for
con
us
las
to work
organizaciones de la
together
sociedad civil,
with
con la industria
CSOs,
farmacéutica y con
with
el
the
sector
pharmaceutical
académico,
industry,
en
and
la
with the academic
búsqueda de un
sector,
diálogo
aiming
estratégico
to
y
create a
el
strategic
fortalecimiento de
dialogue
las capacidades
and the
técnicas.
strengthening
Entonces,
of technical capabilities.
la estructuración de una red
So the
integrada
structuring
de
of
tecnologías
an integrated
sanitarias donde
network of
podamos
technology
trabajar con los repositorios
where
de
we can
evidencias,
work
con el mapeo
with
de esas barreras, con las
evidence libraries,
herramientas que estén
with mapping
disponibles a
of
los
these
países
barriers,
para
and the
avanzar
tools that
y
are
que
at
se
the
pueda
disposal
no
of the
solo
countries
prestar la asistencia
so that we
técnica,
can
pero
provide not only
intercambiar el
technical assistance,
conocimiento.
but
Muchas
also
gracias.
exchange in knowledge. Thank you very much.
Muchas gracias, Juliana.
Thank you,
Nos has
Juliana.
mostrado dónde
You have shown how, with different examples, you have shown us these access gaps and how to broaden this cooperation between countries so that we can close them. Now, let's talk about quality. Let's talk about quality as a fundamental access to be able to broaden that access. And for that, I would like to introduce my colleague, Alexandra Mata. Alexandra Mata works at PAHO as a technical officer in everything that has to do with quality management systems, where she supports medication regulatory strengthening and other healthcare technologies in the region. She does technical advisory for quality assessment, implementation of management systems, and support to national regulating authorities to improve their regulatory maturity. Alexandra has a Pharm D or a PhD in pharmaceuticals, pharmaceutical studies. She has a master's degree in sciences and everything has to do with regulatory science and and a master's degree in economics from pharmacoeconomy healthcare. Pharmaconomics and healthcare. Sorry.
Muchas gracias, Miguel y colegas
Alexandra, thank you,
organizadores
colleagues,
del
and
evento.
to all the organizers
Es
of
un
this
placer
event.
poder
It's a
acompañarlos
pleasure to be
el
able
día
to be
de
here
hoy
with you
en
today
este
in
webinario.
this webinar.
Les doy la más cordial bienvenida
I
y
give you the
les
warmest
voy a
welcome.
compartir
I'm going to be
algunas
sharing with you
consideraciones
some
de
considerations
alto nivel para medicamentos biológicos y biosimilares en la
for
región en temas
biosimilars
relacionados con su calidad
and biological
y en
medication
búsqueda de
related to
eficiencias.
quality and aiming for efficiency for biologicals
Si
too, biosimilars,
podemos
etc.
confirmar
So
que se
if
ve
we
bien
can
la
confirm that you
pantalla,
can see my
el modo de
screen.
presentación. Sí, se ve bien, Ari. Perfecto, muchas gracias. Entonces, en los próximos 10 minutos vamos a
So
recorrer el
over the next 10
contexto
minutes, we're going to
científico
go over the
regulatorio,
scientific
la
regulatory
situación
context,
actual en
the
Latinoamérica
current
y el
situation in
Caribe,
LATAM and the
las
Caribbean,
oportunidades para fortalecer nuestros
opportunities to
marcos
strengthen our
normativos y un
regulatory
mensaje final
frameworks,
que busca
and a key
generar
takeaway
una serie
message
de
that aims to
recomendaciones y
generate a series
llamados
of
a la acción
recommendations
y
and
pasos
calls to
inmediatos a
action
seguir.
and upcoming steps to follow.
Empezamos primero diferenciando
So
y
let's start
teniendo un
by
poco de
differentiating
contexto, ¿no?
and
De
have a little bit of
cuál es la
context.
diferencia entre un medicamento genérico y un biosimilar.
Um,
En esta diapositiva podemos ver
and biosimilar, so in
al
this slide,
lado
we can see
izquierdo en
on the left,
anaranjado, un
on orange,
medicamento genérico constituye una molécula pequeña de
how
síntesis
a generic
química
medication has a small molecule, a
idéntica
small drug
al
molecule
medicamento de
that's
referencia y
identical
que se
to the
aprueba
reference medication
por las
that's
autoridades
approved
reguladoras,
by
demostrando
regulatory authorities,
identidad analítica y
proving
equivalencia. Por otro lado,
bioequivalence.
resaltado en un celeste, vemos
As
los
you can see
productos
in the blue,
biológicos
we
que
see
son muy
biological
distintos.
products
Son
that are quite
proteínas
different.
grandes
They're
producidas en
big
sistemas
proteins
vivos conformadas
produced
por
in
poblaciones de
biosystems
moléculas
formed by
y que
molecule
en algunos
populations,
casos
so that
presentan
in some
variabilidad
cases
entre lotes.
show variability
Por
between
eso,
both.
para los productos biológicos
So
y los biosimilares
for
decimos que el
biological and
proceso
biosimilar
es el
products, we
producto
say
y que
that
por lo
the
tanto los cambios en el
that the
proceso pueden
process is
cambiar
the
la
product, and
molécula y su
thus changes in
perfil
the
de
process may
eficacia
change
o
the
seguridad.
molecule and its efficiency or safety profiles.
Es así como definimos
So
tres
this is
conceptos
how we
básicos.
define three
Primero, que
basic
un
concepts.
producto
First,
bioterapéutico es un
that a
medicamento de
biotherapeutic
origen
product
biológico
is a
que
medication
ha
of
sido
biological
elaborado a
origin that's
partir
been
de
designed
organismos
and
vivos
created
y que
from
según la
bacteria,
definición de la
yeast,
OMS han sido
fungi,
procesos,
cells, and even
han sido
plants or
sometidos a
whole
procesos
animals
de
that have been
manipulación
submitted to
genética.
genetic manipulation
Tenemos
processes.
también los
We
biosimilares, que
also
es un
have
producto
biosimilars,
bioterapéutico que ha
which is a
demostrado ser
biotherapeutic product
altamente
that has been
similar en
proven to be
calidad,
equivalent in terms
seguridad
of
y
quality,
eficacia
safety,
a un
efficiency, and
bioterapéutico de
efficiency
referencia que ya ha sido
to a
autorizado.
biotherapeutic product
Y
that
un
has
producto de
been previously
referencia, que es el
authorized.
producto
And the reference
comparador,
product, which is
que
the
se
comparing
utiliza en los
product
estudios de
that's used
comparabilidad,
at
que
comparability
son
studies
directos con el
that are
biosimilar.
direct with the
Cabe
biosimilar.
destacar que
It's
evaluar y
worth
autorizar
highlighting that
biosimilares
assessing
es
and
más
authorizing biosimilars
desafiante que con
it's even
genéricos
more
y
challenging
que
than with generic
precisamente
ones.
por la
And that
complejidad
precisely
de
because of the
estas
complexity
moléculas
of these
es
molecules,
importante
it's
abrir
really
espacios
important
para
to
el
open
reliance
the
y para las
floor for
decisiones
reliance
basadas en autoridades
and
de referencia
for
que hayan demostrado un alto desempeño en
benchmarking
la supervisión
based
de estas tecnologías
decisions
sanitarias.
that have proven that these healthcare
Si
technologies
comparamos en
are
la
safe.
situación
If we
actual
compare the situation in the
en
region,
Latinoamérica y el Caribe, el
Latin
2009 a
America and the
cómo
Caribbean
estábamos en
between
el
2009
2009
and
versus el
2019,
2019, podemos ver un avance claro.
we see a huge progress. In 2009, the authorization requirements for biotherapeutic medications were scarce. Actually, they were applying similar regulations to regular traditional chemical synthesis medication. And for 2019, we saw how many American countries have already introduced or drafted a regulatory framework that had to be specific for biosimilar products. Some examples: Chile, they have a process that's specific to biosimilars ever since 2011, and Colombia has had that since 2014. We see countries in Central America like Guatemala that are using regulatory reliance ever since 2019. However, the number of approvals and the use in the real use of biosimilars in the region is still too limited. So, taking a look at the real work practice in a region, the regulatory requirements tend to be similar. We see that the countries that have regional authority have similar requirements for biosimilars. We follow guidelines from PAHO to make sure that there are no clinically significant differences between both, but also we find important differences between countries. For example, in definitions and nomenclature and in requirements for benchmark products and for certain biotherapeuticals. So it's worth mentioning that some agencies like Anvisa and INVIMA had implemented fast tracks for biosimilars. From this diagnostics, we were able to see and highlight three main improvement areas. First, access to info, more info that can be more transparent at the registry dosing and public records to create trust or generate trust between authorities and facilitate regulatory reliance, surveillance. Obviously, that can help us to have an uniform denomination and a clear traceability to survey these biosimilars in a better way. Obviously, everything that has to do with the exchange, because it's a key area. At this moment, the region has specific guidelines. We create uncertainty between funders. These gaps represent concrete opportunities to move forward in the next decade. Now, what can we do to strengthen regulation of biotherapeutic products, including biosimilars in the region? Well, some considerations that I would like to highlight as key pillars, key cornerstones for the efficiency of biological and biosimilar medication, starting from the first cornerstone that will be to establish, align, and adopt standards and implement standards for manufacturing and assessment that can be appropriate for biosimilar products that can be in line to international WHO guidelines. For example, back in 2022, I would like to highlight that WHO published the guidelines and evaluation of biosimilars that was adopted by the 75th meeting of the World Health Organization, for the expert committee on biological standardization, so that in the region we can align these regulatory frameworks to the new knowledge of regulatory sciences. By being able to have this as a key pillar, we create a common language for the characterization of quality, potency, and the management of changes after its registration. Second pillar, or second cornerstone, I would like to highlight that we need to use regulatory decisions from other jurisdictions and collaborative procedures for the fast-track registry of pre-qualified products by WHO and regional mechanisms as regional regulatory funds. Regulatory funds. Both mechanisms is pre-qualification from WHO and fast-track the access to biosimilars for high quality. Quality has been proven. Third pillar, we need to move forward to common regulatory framework. We need to have shared definition for biosimilars benchmarked products and definitions for the exchange of these regulations to ensure clinicians and investors. As we saw, these guidelines that were published by WHO back in 2022 help us so that by using the BARF network, we can, or the PNDRH network, the Pan American Network for Drug Regulatory Harmonization, the region to harmonize certain criteria. Actually, back in 2011, there was a publication, a technical document number 7, that aimed to do a harmonization in the assessment criteria for biosimilars. However, with the progress over the last few years of regulatory sciences, it becomes necessary to update this technical document using the guides that we mentioned before, with which we have. But always let me highlight that this network is really important to be able to create regulatory convergence and to move forward in the development of regulatory frameworks and assurance of quality in the region of the Americas.
And as a fourth pillar, we have to reinforce surveillance after the commercialization of the biotherapeutical and biosimilar products. And currently we have the AGBT, which is the World Assessment for Regulatory Systems, and this tool allows us to identify gaps and prioritize improvements. So we would like to tell the countries to continue strengthening the regulations with this tool. But at the same time, the most important thing is to make those development and institutional plans official. And these improvements that are identified should be supported and implemented through the PAHO and other international organisms that generated efforts at a regional level for strengthening regulations. So as a summary, we would like to propose a roadmap of 4 different steps for facilitating the quality and efficiency of these types of technologies by adopting international standards for ensuring the quality of biosimilars and implementing efficiencies in the supervision of these through the life cycle of the product. Also taking advantage of the reliance and technical cooperation of regional mechanisms like the regional rotary funds for having more agile decisions and to converge in decisions and exchanges and to strengthening pharmacosurveillance and regulatory efforts. With these elements, the region can broaden their safe access to biosimilar medications. And a final message for closing, or takeaways, I want to tell you that innovation saves lives, but regulatory convergence multiplies lives. If we have same standards, we reinforce surveillance, and we use international cooperation, we can guarantee that the biologicals and biosimilars can get to the hands of every person with the same quality and safety that they deserve. Thank you very much. I'm open to your comments and questions. Thank you very much, Alexandra. In this presentation, we have been able to see how to strengthen regulations of biotherapeutical products through the different strategies in order to advance in having better products and technologies with assured quality. And which tools can we have for doing the assessment of the policies that will be used for the countries in the region? And this is the next step that is going to be explained by the colleagues of the IDB. And I would like to introduce Pamela Gongora-Salazar. She's a specialist in health and the Division of Health, Nutrition, and Population, the IDB, with more than 15 years of experience in economy and health policies, with an emphasis on health prioritization, economic assessments, and interventions and a focus on reducing the load of non-communicable diseases. Pamela is an economist at the Javeriana University in Colombia, Magister in Economic Policy in the University College London, and Magister in Social Policy and Planning in the London School of Economics. And she's also a doctor in population health in the Health Economics Research Center in the Oxford University. You have the floor, Pamela, but I would also like to introduce Professor Jaime Spin, who is also going to be a part of this presentation. Jaime has a degree in the law of Granada, Master in Economy and Health, and Director of Sanitary Organization of the Andalus School of Public Health. He's a professor at the Public Health School in Andalus, where they teach price policies, reimbursement of medications, economic assessments, and he's also focused on the pharmaceutical policies. He's been the professor of analysis economics at Harvard, and also an advisor in the European Commission, the WHO, World Bank, IDP, PAHO, and has more than 100 publications. So I would like to invite you to see how this was conceived and how the tool was created.
Miguel, muchas gracias.
Thank you very much, Miguel.
Por favor, primero voy a compartir. Y me deja saber, por favor, si se ve bien la presentación. ¿Se ve completa?
Can you see the screen?
Gracias.
Yes.
Bueno, a todos muy buenos días y muchas gracias.
Good morning to everyone. Thank you very much for joining us. It's really nice to see more than 500 people connected. This means that this topic is of high interest. We're very glad to have you here. And I would like to thank the PAHO for this joint work. I think that there are many synergies that we can find here, and they should be at the service of the needs of the different countries in order to respond to the pressures that the health systems are facing today. Jaime and myself, we're going to present the tool and tell you how it was developed and how do we think that this can help the countries of the region in this urgency to respond to the pressures of pharmaceutical expenses. So I would like to begin by telling you what is the framework that we have been developing this in, and that you can find it in this publication that we published 2 years ago that's called Intelligent Expenses in Health, and that compiles the agenda of efficiency and expenses that we want to highlight on what are the needs to improve and what's necessary to improve these expenses in health, and what are the measures that we can take into consideration from the procurement of health services that are adequate and to improve agreements and to reduce waste from drugs that do not generate value and that can even be hazardous for the patients. This is the framework, and it responds, and it is just to remind you from the micro standpoint why we have to talk about this. The countries of the region have different demands and needs in terms of health, and these needs are increasing at a higher rate than the resources that are available. So expenses in the health system, we have to remember the restrictions related to economic growth and a public debt that continues to grow, and inflation that's higher after the pandemic. 1/5 of the expenses in health, I'm sorry, the audio is not that good. This is a call for improving that efficiency and expenses in health, and what we're documenting in this publication. And why talking about pharmaceutical expenses? What Juliana presented, as some of you know this already, especially the ones that work in the ministries and the regulatory authorities, it's not the most important expense, or it's not the high expense per se, but it is the one that is increasing at a faster speed. And it's the most important thing in terms of the home budget. When we see this graph, we found that in 2 years, for many other countries, this percentage of the expenses in health, and we see increases of 2 or even 4 percentage points in 2 years. And this shows us how expenses are increasing so fast, reflecting the arrival of new technologies in these countries. There are estimates that show that between 2025 and 2029, the expected increase of health expenses in Latin America and the Caribbean is over 35%. And what is the situation of growth in this moment? approximately between 2013 and 2017, we're talking about a growth of 12%. So we're going to go from 12 to 35% in terms of growth, and it's a lot of growth for pharmaceutical expenses. And it's even higher to what we are able to observe in other regions, like, for example, North America. It's 4 times higher than that region, or 6 times higher of what's being recorded in Europe. So that is why we're doing this call for responding to this increase in pharmaceutical expenses in order to ensure an equal access to the drugs that are needed by the population, and to contribute to the sustainability of our health system. Sorry, but she's speaking too fast. Thank you, Pamela, for participating in this webinar. It's a pleasure to have you here. An important element that has been highlighted before has to do with the difference between biosimilars and generic drugs. I'm not going to repeat the difference, but I think it's very important from the health economy standpoint to highlight that the production of biosimilar is a lot more expensive than the production of generic medicines, and that the clinical development of biosimilars is a lot more expensive than the generic drugs. And this means that the competition is very different. If we go to the next slide, Pamela, please, we can see a graph, a classic graph with the generic drugs. And the more generic drugs there are, the more discount you can find in the market. And this graph, as we've seen, there can be 20 or 25 different generic drugs competing in the market. We have not seen this with biosimilar drugs. Europe is the region with the most experience with biosimilar drugs, and possibly the active principle would be 6 or 7, and we haven't seen any product with more than 10 biosimilars. So we do not expect, as I said before, for the discount, and this is very important for the public payers that are attending to the seminar. Currently, we have not seen the European experience that the discounts that can be achieved with biological products or biosimilar products can be so big as the discounts that we've seen with generic products that go up to 80%. This does not mean that this is still a significant amount, because the price of biological drugs and biosimilar drugs are usually higher than the generic drugs. Something important that the tool has, and something that we have developed with some colleagues of the IDB, is that this is aligned with the policies that the WHO recommended in its guideline, its last guideline. They have talked about policies based on evidence, and that's our main objective. We wanted to create a tool that would collect the recommendations from the WHO that we can see in this slide and in the next one, where they talked about quality. And they recommended a set of policies and practices, but we wanted to go one step beyond, and not only collecting the recommendations from the WHO, but also to create a document, if you can skip this slide, a document where we will see that we have collected all the evidence that we have collected for including the policies that are the most important in terms of clinical evidence. Before diving into the tool, I would like to tell you the study and to present the case study on why to continue promoting these drugs. I'm sorry, the audio is not good. And this shows us what is the opportunity that we have for increasing that space in the market where generic drugs, biosimilars, can replace the original drugs for reducing the burden on our public budget. Even though generics represent most of the available volume in the countries with middle income, the original drugs continue to absorb most of the expenses. And generic drugs represent approximately 75% of all available
solamente
drugs,
constituye una proporción
but only
mínima
represent a low
del 20 y el 40%.
rate of approximately 20 to 40% of the
¿Qué hemos
pharmaceutical
encontrado? ¿Qué es lo que dice
expenses.
la herramienta? Y acá
No.
solamente es de nuevo uno de los ejemplos de los tantos que se
This is one of the
encuentran
examples of the many
en
that can be
acá
found in literature.
imagen que sacamos justamente del CERNAC de Chile, que en donde
This
muestra o
image
compara
was obtained from
un
Chile,
producto de
where
marca
they
con un producto
compare
bioequivalente,
a
cuáles pueden
branded
ser los,
product with a
los
bioequivalent
ahorros. Y este
and what
solamente es
are
uno de
the
tantos,
savings.
tantos otros
And this is
ejemplos
just
que
one of
encontramos
many
en
examples that we have.
presentación. Los medicamentos genéricos permiten ampliar el acceso
Generic
porque
drugs
son
are allowed
clínicamente
to
equivalentes, pero
broaden
son
access because they're clinically
significativamente más
equivalent, but are
asequibles. Y ya lo
significantly
decía
more
Jaime también,
accessible.
pueden ser hasta
And Jaime said this
80-85%
before, they can be
más
up to
baratos
80
que
to
sus originales.
85% more cheap than the
Como
original
decía al
drugs.
principio, los impactos no solamente son desde el punto de
And
vista del
these
sistema de
impacts
salud, sino
not only
también de
come
los
from
bolsillos.
affect the health system,
Tenemos
but
dos
also
estudios que queremos
the
compartirles
budget of
aquí
the
con
homes.
resultados.
There
Uno
are
acá
two
de
studies
República
that we want to
Dominicana
share
y
with you.
otro
One
que
is
está
in
en
the
Chile, donde
DR and
estábamos
the other one
justamente
from
explorando
Chile,
cuál es esa
where we're
oportunidad que
exploring
tienen los
what are
países
the
para
opportunities
mejorar la
that the
eficiencia del
countries have
gasto
to
al promover
improve the
esta
efficiency
sustitución
of
hacia
expenses when
genéricos,
doing this
que son en todos
substitution
los
to
genéricos sin marca.
generic drugs, and
En el caso de
especially
República
the
Dominicana,
generics without a
estimamos que
brand.
el
In the case
régimen
of the
contributivo
DR,
podría ahorrar
the
anualmente
contributive
entre
regimen
13
could
y
save
60 millones de
between
dólares
13 to 60 million
al
dollars a
sustituir por
year
genéricos sin marca.
when
¿Qué
substituting
significa esto en
to
términos de
generic
costo?
brands. What does this mean in terms of
Digamos,
costs?
desde un punto de vista del tomador de decisión, sabiendo que además
From the decision-making
los
standpoint, we
recursos son
know
limitados,
that the
que esos
resources are limited,
ahorros podríamos
and those
estarlos
savings
dedicando hacia
could be
intervenciones
allocated
altamente
to health
costo-efectivas,
interventions that
que son
are
esenciales para los sistemas de salud y sobre
essential
los
for
cuales
the health
todavía existen
systems
brechas importantes.
and where there
En
are
el caso, por
important
ejemplo, de
gaps.
República
In the
Dominicana,
case of the
encontramos que
DR,
esos
we
hogares
found that
podrían ayudar a
those
reducir
households could
prácticamente
help
cerrar
to
la brecha
reduce
en el
or
caso del
close the
cáncer, la
gap
detección de
in the
cáncer
case
uterino y
of
cerrar la brecha
cervix
en
cancer,
59, casi
and to close the
60%
gap
en
in
detección de
59 up to
diabetes
60% in detection
para los
and
hogares,
control of
¿esto qué
diabetes.
significa? En el caso del estudio
So
de
what does this
Chile,
mean for
que
the
estamos
households? In the
compartiendo
case of
aquí, el
Chile,
ahorro anual estimado al cambiar de medicamentos de
the
marca por
yearly
bioequivalentes sin
savings
marca
when
asciende a
changing to a generic
283
brand,
millones de
the
dólares al
savings
año.
will go up to
Esto es
$283
básicamente
million.
10.3% del
So
gasto
this is
total de medicamentos.
10.3% of
Este
the
ahorro que
expenses
permitiría,
of
por
drugs.
ejemplo, para
This
representantes de
savings will allow
transporte.
to pay for 2 months of
Esto
transportation per
solamente es
year.
uno, digamos, de otros varios
And this is
ejemplos que
just
podemos
one of many
compartir de
different
cuál es el
examples that we
potencial
can
que tienen
find
las
of what is the
políticas
potential that
públicas en
these
genéricos. Y sería
substitution
bien
policies
similar a
have
su
for
punto
generic
también.
drugs and to
Por tanto, ¿qué opinan
biosimilars.
más al respecto de la experiencia europea?
Sí,
I'm just going to
claramente los
share the
ahorros
European
europeos sí demuestran
experience.
realmente los potenciales ahorros.
This
En
shows
el
the
contexto
potential
europeo
savings,
también hemos
excellent
visto
work.
este tipo
In
de
the European
exercicios
context,
con
we've
otros
also seen these
productos
types of
antibióticos.
exercises taking place with
Recientemente,
biosimilar
hace 2
products. And
semanas, se
recently,
publicó un trabajo
2 weeks
reciente
ago, there
en
was
el
a
cual demostraba que entre el
biosim
año 2020 y
publication that demonstrated that
2023,
between
comparado
2020 and
con España,
2023,
48
in a country
millones
like
de
Spain
habitantes,
with 48
el
million
ahorro es de
inhabitants,
5.800
the
millones,
savings is of
solamente con la
5,803
política
million
activa
euros,
de
just with
incorporar
the Astiga
medicamentos
policy of
y si hablamos de la
including
Unión
biosimilar
Europea,
drugs. And if we
155
talk about the
habitantes,
EU,
en el
with
año
150 million
2014
inhabitants
el
since the year
ahorro ha sido de
2014, the
56
savings have been of
56
56
billones de
billion
euros. Lo más
euros.
importante no es el
The most
pasado, yo
important
creo que lo
thing
más
is not the
importante de los
past. I
medicamentos
think the
biosimulares
most
es el
important
futuro.
thing
Muchos
in
productos
terms of
probados
biosimilars is the
perdieron la
future.
patente
Many
después de unos años,
biological
lo recuperaron
drugs
con médica libre,
lost
tenemos muchos ejemplos,
patents.
y hay un
There are many
potencial de
examples of
ahorro,
this, and there's a
no
potential of
tanto a
savings,
veces en
not
términos
so
relativos,
much
porque a veces el ahorro puede
in
ser
relative
muchísimo más
terms,
que en él,
because
como
many
dicen
times the
20,
savings can
30,
be even
40,
more than
pero sí en
up to
términos
20, 30, or
todos
40%. But in
sabemos
absolute
el
terms,
alto precio
we
de los
all know
medicamentos
the high
biológicos
price
y
of
el ahorro de
biological
un 20
drugs
o
and the
30%
savings of
en
20 to
medicamentos de alto
30%
costo,
of
sin duda alguna
high
es
cost drugs
un ahorro bastante significativo,
is
como
an
lo que
important,
observamos, por
significant
ejemplo,
saving,
en
like this
Europa,
report
que sí
tells
vemos
us in
frecuente
Europe.
en América Latina.
And this happens less often in
En
Latin
esta misma
America.
línea, quiero de nuevo agradecer a Pamela y al equipo del BIR
I would
por
like to
la
thank
preparación
Pamela
de este
and the
trabajo
IDB
que
team for
tenía un
giving us the
objetivo
opportunity to
muy
show this
claro de
work that had
desarrollar un
a
marco para
clear
evaluar
objective, which
políticas,
is to
porque
develop a
los que venimos
framework
del
for
mundo académico
assessing
siempre
policies.
somos
The
algo
people who come from the
críticos
academic
con
world
la
were
falta
very
de evaluación de
critical
políticas,
with a
¿no?
lack of assessment
Algunos me
of
conocéis, he
policies.
hecho algunos informes
Some of you
anteriores
know
para el
me,
equipo del
and
BID y
I've
para el
done
PAS,
reports for
pero
the
lo que queríamos
IDB and for the
básicamente
WHO, but
no
for the
solamente
PAHO, I'm
trabajar
sorry.
en el trabajo
But I
previo
wanted not only to work with the previous work done by the WHO with the generic policies and biosimilar policies, but I wanted to revise the evidence of which policies for generics and biosimilars have worked better in the last years. And as I said before, these are evidence-based policies. And I would like to highlight what Veronica said from the Boston University and also Ana Maria de Santiago Palacio, who did a wonderful job by looking for literature. This was coordinated by Pamela from the IDB. So we have found more than 300 studies. You can see the flow chart that will be published very soon by probably January or the end of the year, where a peer review magazine wanted to show what's the most important evidence of every policy, because that evidence would allow us to develop a tool. Something else that we wanted to avoid, because many times when we talk about policies, sometimes we focus in Europe too much because of its high tradition in regulating pharmaceutical policies. And what we have found in generic drugs and biosimilar drugs is that we have obtained evidence not only from Europe, but evidence that can be extrapolated to other contexts. And you can see that the evidence that we were able to collect is well distributed all around the world in South America, North America, Europe, and Asia. And we found that the policies that we're going to recommend aren't focused just in one region, but it has broad evidence at a global scale. An important element, and I'm sorry for the small print, but this publication will be available very soon. So basically, we have guided ourselves with a classic policy model and for results. And let me explain this. The policies are separated in two different parameters, which are offer and demand policies. The offer, without going into depth, has to do with regulatory aspects that have been explained previously by my colleagues in the PAHO. And for those policies that would like to regulate the price directly or indirectly. And so we've seen all this evidence, but it's not only enough to take in consideration regulations. It's important also to take into account the demand policies. And these policies have to do with different stakeholders that can affect the use of biological and generic drugs and biosimilar drugs. It has to do with the prescriptions, with the users, and with the pharma industry. And these policies of the offer and the demand has been seen in the ones that belong to biological products, like you can see with the biosimilars that have a triangle, and those that are just generic, and for those that are applicable to both. And on the other hand, I think that this is an important part of the tool that we're going to explain more with detail, is that we want to look for results, and the results have to do with the market quota, that are the classic patterns, and what's the percentage of prescriptions that have been sent, and a set of variables that can demonstrate if the policies have been successful or not. What we're going to do afterwards, and Pamela will explain this, we have translated these policies and these results into an assessment tool that will allow to know how every country looks like in the implementation of policies for drugs. And the most important thing about this, before giving the floor to Pamela, has to do with that all these recommendations that are based on that evidence that we have found in literature. Pamela, you have the floor. I'm sorry, but you're speaking way too fast. Thank you very much, Jaime. So based on this exhaustive revision of the literature, we were able to develop and publish this tool for assessing policies for generic and biosimilar drugs. This allows us to identify where are the advancements, but also where are the spaces for improving, what are the gaps for improving the policies on generics and biosimilars, and to have a better penetration and participation in the market, and broadening competition, and also reducing prices and increasing access. This tool is already available. We shared the link in the chat so you can download it. It's in English, and next week will be available in Spanish.
bueno, decir antes de un poco entrar en el detalle, todavía no lo
And
hemos
before
aplicado,
going
pero estamos
in depth,
justamente en el
we
proceso
have
de
not applied
aplicarlo
this
en
tool
varios
yet,
países en la escuela
but we're in the
nacional.
process of applying in several countries.
Permítanme un poco hablar un poco de cómo la
So I would
estructuramos
like
con
to
base en
talk on
estos
how
hallazgos de la
we
literatura que comentó Jaime,
base this on
qué es lo que
literature
consideramos que
findings
puede ser
and what we
interesante
can
para los
see that
países
could
al
be
momento de
interesting for the
implementarlo.
countries when implementing it.
La herramienta tiene, digamos, tres
The tool has
elementos
three
componentes,
components.
podemos llamarlo de esa manera, importantes. Incluye una evaluación cualitativa
It includes a
basada en
qualitative
preguntas
assessment
binarias,
that's
en donde
based on the
analiza
binary
básicamente los
questions
procesos y
where
diferentes
they
políticas,
don't
tanto de
analyze the
oferta
process
como
of
de
different
demanda,
policies of the
relacionados
offer and
con
demand
medicamentos fuera de
related
patent.
to
A esto se
drugs that
complementa una
don't
evaluación
have
de
a
los resultados
patent.
cuantitativos,
And
que
there's also an
básicamente lo que
assessment
hace
of
es
quantitative
capturar esa
results,
parte,
which
esa imagen en
captures
la derecha que estaba presentando Jaime sobre los resultados, los outcomes. Por lo
the
general, a veces lo
outcomes.
olvidamos, pero es lo que muchas
And
veces
sometimes we
como
forget about
tomadores de
this, but it's
decisiones
what
necesitamos para mostrar
we as
cuál es
decision
el
makers have
efecto
to take into
monitorial
account
y
to demonstrate what's
evidencia
the
si realmente estamos
effect and
consiguiendo lo que
monitor
estamos buscando.
and evidence if we are actually finding our
Y también
goals from the
incluimos, no es
public
menos
policy
importante,
standpoint.
un
And we also
apartado que lo
include
llamamos un contexto de país.
something that we
Son
call
datos
the
agregados
country context. And
socioeconómicos
this
sobre el
is
sistema de salud y
aggregated
información para
socioeconomical
mostrar
data
que
from the
también
health system and
permite un
other
poco al final
information that
detallar
allows
esa hoja de ruta que se puede
to
seguir en
show
un
the
país y
roadmap
que se
that
podría
can be
adoptar
traced
para avanzar
or outlined for
en este
advancing
tipo
in this
de
effort.
políticas.
Pamela,
Bueno,
podríamos ir de pronto agilizando un poco
sí,
esta parte.
perdóname,
Can you
sí,
speed
ya
up?
sé que estamos un poco, que nos hemos un poco
I know that we're
alargado.
running out
Bueno,
of time,
incluye demanda, oferta y los resultados
but
sobre
this includes offer,
equidad,
demand,
sostenibilidad,
the
uso
results
racional
include
y aceptación por
quality,
parte de la
accessibility, rational
ciudadanía.
use, and
No
expectation
podemos entrar
by
en
the
el detalle de
citizens.
todo, porque
We cannot go
son varias
into depth
páginas,
with
pero
everything because there
solamente
are several
mostrarles
pages
un
about
poco
this,
cómo es
but
que
we
van a
just
ver la
wanted to show you
herramienta.
how
Van a
the
ver un
tool
apartado de políticas de
looks
oferta
like.
y
You're
otros de
going to
demanda
see
con unos
policies of offer
subapartados
and another
adicionales.
for
Cada
demand,
pregunta o cada elemento de
and every
evaluación de la
question or
herramienta
every
incluye un
element
breve
that's being
párrafo
assessed in the tool
explicativo con
includes
orientaciones para su
an
interpretación
explanation and
en
guidelines
distintos
for its
contextos.
interpretation in
Acá
different
pueden ver, por ejemplo,
contexts.
para el caso de oferta,
You, right here for the offer, we can see a
incluyen
question
las tasas de registro sanitario
how
para
to include
medicamentos fuera de patente
sanitary
son
registrations
menores que las de
for
los productos originales
drugs
innovadores,
without
explicando
patents
un
that are
poco
less
la
than the innovative
racionalidad o la
and new
interpretación de
products,
la
and
pregunta
explain
y
why
cedemos
this
los espacios
question
para la
appears there, and
respuesta,
we
la
have
fuente de
spaces for the
información que sea
question, the
importante
source of
y algo de
information that's also
información
important,
contextual que también
and
sería
some
relevante.
context
En el caso de
information.
demanda, acá también para
I'm sorry, but
contarles
we're gonna
algunos
have to
ejemplos
summarize.
que van a
These
encontrar
are
en la
some
herramienta.
examples that you
Por
will find in
ejemplo,
the tool.
sustitución en el punto de
For
dispensación o
example,
venta es obligatoria o
substitution
voluntaria y
is
también
mandatory or
buscamos ver si es
mandatory,
obligatoria o no, o si las recetas deben redactarse
or
utilizando
the
la
receipts have to be
denominación común
redacted by
internacional,
using common
INN
international
con sus siglas en
denomination.
inglés, y, digamos, de nuevo, respuesta, fuente de datos e información
And
contextual
there's one of
adicional.
source of data and
En
context
el caso
information.
de la medición del efecto de
In
las
the case
políticas,
of measuring the
aquí,
effect
digamos,
of the
nos
policies,
atrevimos a incluir
we
un mecanismo de
included
semáforo en donde brevemente
red
estamos
light,
incluyendo unos para
red
la
light, green light,
interpretación,
yellow light
unos umbrales a través
system.
de los tres
We have
colores verde,
thresholds
amarillo y rojo,
with
para
these
también
colors,
tener una
green,
idea de
yellow,
cómo
and
está
red,
avanzando
in
el
order
país y
to
qué impacto
have
están
an idea
teniendo
on
las
how
políticas que tienen
the impact of these policies look like
en cada uno de los contextos.
in each
Y
context.
finalmente, como les contaba
And
al principio,
finally,
tenemos un apartado de contexto país que
we have
simplemente busca,
the
digamos,
country
entender mejor
context
cuál es la
that wants to
situación,
better
por ejemplo, cuál
understand
es el
what is
gasto
the
en medicamentos per
situation,
cápita, cuál es el
what are
porcentaje
the
del gasto en
what are
salud
the expenses,
destinado a
what the
medicamentos en los últimos años,
rate
entender un poco la tendencia y tener en
expenses in the
cuenta
last
todo ese
years to understand the
contexto antes
trends,
de lanzarnos a hacer
and
alguna
to take this
recomendación
into account
sobre cuál es
before
esa hoja de
issuing a
ruta para cada
recommendation
uno de
of
los
what is the
países debe
roadmap that
seguir
every country
para,
has to
o
follow
podría seguir para mejorar
or could
y
follow
aumentar la
for
penetración, por
improving
ejemplo,
or improving the
cada país
penetration.
es particular, eso es algo que
Every
tratamos de tener
country
también en
is
cuenta en la herramienta
specific.
y por lo
We
mismo es
try to
que,
take this into account in the tool,
digamos, tenemos en cuenta justamente
and that is
ese
why we
elemento
take
sobre
into
el
account
contexto.
that element of the
Jaime,
context.
¿quieres mencionar algo antes de cerrar sobre
Jaime,
la
would you like to
herramienta?
say something before
Sí, solamente un
closing?
comentario final.
Yes, a final
Como
comment.
vengo del mundo académico, esto no es un
And since I come
examen
from the
y es
academic world, this is not an
simplemente una
exam.
herramienta que permite saber
This
en qué
is a
situación
tool that
está
allows
y el
us to
margen de
know
mejora.
what is the
Y la única,
situation and the
la única manera de
way
mejorar
to
es
improve. And the only
evaluar
way
y
to
yo
improve is when
invito
you are
a los
assessed. And I
países
would
a
like to
utilizar esta
invite the
herramienta, está
countries to
accesible
use this
solamente en
tool.
español para que evalúen qué fase
It'll
está
be
y
available in
qué cosas
Spanish
deben
to
mejorar.
assess what
Gracias,
your
muy amable.
current phase and what you can expect to
La
improve.
herramienta la desarrollamos, como mencioné,
The tool was developed in the beginning with Jaime, Javier, and Veronica Beers, who couldn't join us today, but she's been in the whole process, and I would like to thank the support and the comments received by Santiago Palacio, Ana Majes, and Richard Lane in this development process of the tool. And finally, before closing, I wanted to tell you about the criteria. We have been supporting several countries of the region for more than 10 years for prioritizing health policies and pharmaceutical policies. The tool is being implemented in Panama, which is one of the first countries that have demonstrating interest in this. I would like to invite every country who's here today that are interested to receive our help in the application of this tool. Please contact us. Contact the IDP specialist in your country. You can also write directly to us. We will be very happy to include you in this project. Thank you very much to everyone, and thank you very much to PAHO for the invitation and for this joint initiative.
Muchas gracias a ustedes dos, Jaime, Pamela, por poder
Thank Jaime and Pamela for sharing this information, how this tool was conceived and how it can be applied. And this is not an exam, it's an instrument that will allow us to see what can be improved. And with technical cooperation and support of the countries, we can work to close those gaps that are based on evidence. I would like to continue with the last presentation to the panelists. I would like to ask you to answer the questions in the chat and the Q&A that have been written there. And I would like to give the floor to Nora Girona Ayala, who is a technical official in strategic fund of the PAHO, where she plays a role in the planification, management, and supply of drugs and strategic supplies. She has helped to improve the supply systems and to promote the efficient selection of drugs to help member states to consolidate demand. Nora is a pharmaceutical and she has a lot of knowledge. She's very well known in the region. She focuses on international supply and technical help for health. Then after her presentation, we'll see what are the joint priorities that we can develop between the PAHO and the IDB. So we are going to be running out of time, but please let's have this space in order to know how to answer to these needs in the future. Nora, you have the floor. Thank you. Thank you very much for inviting me.
Parece que tengo problemas en compartir.
Ya está cargando, vemos tu escritorio.
Creo que aquí pasó algo. ¿Qué pasó acá?
Aquí lo intentamos. Eso, ya vemos ahí la presentación. Modo escritorio. Se ve el modo, eso, ahí cambiamos ese y ya lo vamos a ver. Listo.
Muchas gracias. Disculpas. Gracias por invitarnos a esta
Thank you very much for inviting us to this important webinar. I think that from the Rotary Regional Fund, from the PAHO, we have a great responsibility with the countries for supporting on the access and availability of safe, quality drugs. It's important to mention that Rotary funds are a technical cooperation mechanism that is structured in just one program today, and it supports the countries from the strategic fund for the acquisition of drugs and strategic supplies for public health, and the Rotary Fund that also helps on access to vaccines. These are technical mechanisms for cooperation that help with the acquisition or having access to vaccines and essential drugs and other public health supplies. It's important to mention that we work with every country by planning the regional demand and consolidating this demand and promoting joint procurement processes so that we can benefit the countries with better prices and better opportunities when delivering these products. The regional Rotary Fund portfolio is very broad. Every day it grows and it changes due to the necessities of the different countries. The Rotary funds are part of the countries, and we are deeply involved throughout the supply chain because we're basically part of the process of procurement for drugs or diagnosis kits, vectorial support, and vaccines and all this. In the area of drugs, we have a broad catalog for communicable diseases. The strategic fund actually was born for supporting those countries for strengthening the supply of drugs for HIV, tuberculosis, and malaria, but also for working with those products that are hard to obtain in the region that many times do not have a generic option. And these are drugs that come from just one source, usually. And we have been working very hard with the suppliers and also with the different countries to have generic products available or generic options. We also have an important catalog of non-communicable diseases. And it's important to mention that we are working with hypertension, cancer, diabetes. And with most of the products that we are acquiring are generic. And this year, we have included a category of highly priced drugs for rare diseases that include many biotherapeutical drugs and that are in the process of doing biddings for being able to have better prices. Regional Rotary funds are in 42 countries and territories. We work with the ministries of health, but we also work with other health agencies, including the Social Security Institution. And we have made an estimate that in these years of work with the Rotary funds, approximately 160 million people have been directly impacted by the fund. Because apart from drugs, we are also supporting the countries in everything related to vaccines. And that's why we have been able to distribute 224 million vaccines, because the prices have also have gone down to 50%. And also in the area of drugs, we have been a reduction, especially in antiretrovirals, in approximately 50%. And in these years, we have delivered more than 50 million diagnostic treatments. We have also given access to vaccines that have been produced regionally and distributed through these funds. And what are the advantages and how do we do this work? First of all, we consolidate the demand, and also we also take advantage of the scale economies in order to achieve more competitive prices. One of the fundamental pillars of these funds is to ensure the quality of the drugs, but also to give technical support that goes beyond the procurement process. And we like to work with the countries to see how these products perform in the shelf life, during the shelf life of the product. Also, timely financing through the credit line that can be requested by the different countries, and most of the countries use it. But we also want to become facilitators of processes and give technical support for having an efficient planning process. As our colleague said, we don't want for the products to have a low price and to have suppliers for generic drugs and to have a good competition, but if these products are charged because they are perishable, we have to see the forecast of the demand, and therefore it's important to monitor and to do a market analysis jointly with the countries for deciding which products can offer the best added value. And also the transparency of the processes and accessible prices. And as I said before, and Alexandra mentioned this during her presentation, the Rotary funds have the strict eligibility criteria to ensure the quality of the products. So one of the criteria is for it to be assessed and to be included in the list of the WHO. And this product should be eligible for acquiring through the funds. But if it's not assessed by the WHO, it has to be approved by regulatory agencies from the PAHO and from the WHO. And they have to go through a technical assessment. And the PAHO, they take into consideration international standards that guarantee the safety, efficacy, and quality. It's this technical support that we give throughout the process from the moment that the products are selected and we decide the technical specificities, and also depending on the demand, and also the strengthening of the supply chain through tools that were developed to support the planning process, but also we have a portal for the member states that help to consolidate the demand and also the traceability of the whole acquisition process. And now I would like to show some examples that we've been working and how we've give accompaniment to the countries in order to seek for better prices and also to have generic alternatives in the fund. For Hep C, we work with the countries because there were high prices for these drugs for Hep C. These products were very expensive. You see in 2017, antivirals for direct soft-lead and soft-pill. The treatment cost $10,000, but as we included generic products in 2018, 2019, the price started to go down. So this incorporation of generic drugs helped to have access to Hep C treatments. However, we had many challenges, especially in market constraints.
De los territorios o de los países, en algunos casos tienen protección de patentes.
Many of the countries have patent protection
Los productores genéricos para comercializar.
Or limitations for the generic producers to commercialize the products in these countries. So it's important to work bearing this in mind to see how we can achieve for the product, the prices that we have negotiated can be utilized by the countries. Currently, we have sofosbuvir and declazivir with fixed doses. But this also impacted, as you can see, the prices of the patented products. As a strategic fund, we have been accompanying the negotiations of prices of those products that are patented. And by 2025, we have been able to negotiate that product for the countries that have the patent to $2,970, which is an accessible price. But these prices are a lot higher. Compared to generic drugs. And one of the examples that we have here is how to include and utilize generic drugs for HIV. And this has improved for migraine to optimize treatments based on the schemes that are recommended by the WHO since 2018. When we started to help the countries in this inclusion process for these products. The treatment of tenofovir of 2018, which was generic back then. It cost $70. As more suppliers arrived and there was more competition, Now we have 6 suppliers. The price started to drop and the coverage increased. And this was done through the funds. And by 2025, we have a price of $40 per treatment per year. So this has been quite important because we improved competition and we stopped depending on very few suppliers, and this helped us to increase coverage and to facilitate the migration to the schemes that were recommended by the WHO. One of the categories that the countries have asked for the PAHO to work jointly in order to achieve more accessible prices are the highly priced drugs. And at this moment, we have developed bidding processes for 5 products from the list with 11 presentations for prostate cancer, breast cancer, multiple sclerosis. And we're also working jointly with other agencies for helping the countries with pediatric cancer. And in that point, we have been able to include generic drugs, generic versions of drugs with prices that go from 60 to 90% lower than the prices that are being currently paid by the countries. And this has to do with the availability of generic and biosimilar drugs. This is an example in the case of enzalutamide that is being bought for prostate cancer. You can see that the countries give us the countries before the bidding process for helping us to negotiate the prices. And you can see that the PAHO price is a lot lower than the prices that are being paid by the countries. And we hope that this can help to be more efficient in terms of resource management to have better coverage. And also with palbociclib with 125 milligrams, we were able to receive 2 offers of generic products that are a lot more accessible compared to the prices that are being currently paid by the countries. And this is also very favorable, and it's one of the good experiences that we've been able to record. And finally, we want to have a call to action. We want to work with the countries for ensuring the access to better technologies that are more cost effective, but we need to consolidate the demand and to have regional visibility in order to achieve a better negotiation process. And it's important to highlight too that we have to revise with the member states what are the acquisition policies for generic drugs and biosimilar drugs that allows us to know what are the rules and the norms for every country and to make it easier to import and deliver generic products and biosimilar drugs, and also the harmonization of the regulatory requirements that allows and facilitates that the access of these products with better prices and with a better coverage, and by ensuring the quality of these products. And finally, we have to reinforce the regional production capacities, since we have some products that are hard to acquire and that we have to replace because there are no sources for supplying them. And we also have to maintain to improve the resilience of the supply chains. Thank you. Thank you, Nora. I think that with this presentation, you have showed us the mechanisms of the rotary regional funds for having ensured quality with drugs and technologies for the countries that require it. So we're running out of time, and we're sorry we went over the time. we would like to ask you to first to ask the questions. The questions from the audience are varied, and we can write down the answers to send them to you. And we're asking for a few minutes for being able to map those needs and the joint work that we can have. So our colleague Marisol is sharing 3 questions where you can scan with your phone or going to slido.com with this code to be able to vote. And these are the questions. The first one, in which areas there are more challenges in your country or organization to facilitate the access to generic biosimilar drugs? What are those? What are these options, like regulatory processes, limited availability, high prices for reimbursement, preference of prescription, where these higher opportunities lie at?
All right, so we are we see here so items for as first option, absent regulatory processes, slow or not clear, limited availability in the market, elevated prices, or insufficient reimbursement, etc., etc. So you guys are focusing those 3 options, and that looks really good. For the people that are voting, we have kept these 3 main areas of challenges: regulatory processes, race processes, limited availability. Actually, these were the issues that we were talking about all throughout the presentation, and we are going to address any questions that you may have. We will do it in writing. Marisol, can we go to the next question, please? In what areas do you believe that the technical WHO, POW experience, and the IDBF agency together may support your country and organization? Option 1, policy or tools that will increase competition, for example, offer supply and demand of generic medication and biosimilar medication. Policies or tools to achieve a fair market price for medical devices, and with it, greater access. Policies and tools for medication and healthcare technologies of high cost and a high price. Policies or tools for the promotion of the rational use of medication. And 5th, strategies to respond to the ever-growing utilization in healthcare. We have seen how they are complementary mechanisms to do this. So here we see the votes. Now we are seeing first policies for high cost and high price, fair price, achieving competition, without not leaving aside judicialization in health. And this shows us how can we channel our efforts together with the organization. Thank you. And now, going to our last question. In accordance to your selection of the previous question, what type of support will be more useful or relevant in your country or institution? Monitoring and assessment tools, technical training, support in implementation of public policy, experience exchange between countries, platform of mechanisms for information exchange, or others. Wherever you are, these tools, you will find everything that has to do with training as well. You know how it goes. So now you're doing it way faster, so that's great. And you will get some interesting ideas, first in the subject matters, but in the way we do it. On how to respond to these issues in the region. So I would suggest something respectfully. While people answer, could you leave the last one open, please? Yes, no problem. Yes, of course. So thank you for staying here just extra minutes. We will like highlight generally within this what issues that were mentioned and how to broaden access in the region all throughout the life cycle. What are the different needs of use cases? Obviously, we saw something that obviously there are alarming figures and phenomena associated like digitalization, and also the response to this phenomena as key tools to be able to assess how the countries are prepared for these strategic policies to take care of them, but also to respond to through cooperation mechanisms that can happen. Alexandre, maybe can you close with the general idea about this final reflection? And once again, obviously, thanking our audience that has stayed during the whole event, and obviously that people that have stayed on this edition of Minutes Know. Thank you very much.
Foi excelente e
It was an
agradecer a
excellent
todos que
webinar,
hospedado. Quase, eu creio que llegamos a atender quase 550
and
participantes. Agora,
we are going to have
1.500,
almost
porque nós estamos
50
aqui com um
participants
público
as well.
impressionante.
Four,
Verdade.
five, no, not 50,
Eu
500
creio que
participants.
Javier tuvo que
So,
salir para, pero yo preguntaría a Pamela si
I
quieres
would like to ask,
dar unas palabras también de cierre.
give some
Gracias,
closing remarks.
No, solamente primero agradecer a los
No,
participantes,
just
para la OPS y a todos
would
por
like
este
to thank
espacio
Pajo
muy
and everyone
enriquecedor.
here, the IDB.
Decir que estas preguntas que pusimos al final
These
buscan
questions,
justamente continuar el diálogo.
we
Estamos
want to
identificando de
keep the
manera
dialogue
activa
going
entre OPS y BID de qué forma colaborar más,
and
trabajar más
how
de
to
manera más
collaborate even
cercana, la
more,
unión hacia la fuerza, dicen.
and everything that has to
Eso es
do with
justamente lo que
this,
estamos
and
buscando,
that's
buscar en
precisely
dónde
what we're trying to
focalizar
do.
los esfuerzos
How
para
can
seguir
we
contribuyendo
focus
a la
our
región y
efforts so that we can
apoyar países
contribute to the region and to
en
the
mejorar nuestros
support we're
sistemas de
trying
salud.
to
Muchas
provide
gracias de
in
nuevo.
this healthcare system? So once
Gracias a
again,
ti,
thank you very
Pamela,
much.
a
Thank
Javier,
you,
todo el equipo
Pamela,
del BID por
everyone
esa
here
organización conjunta.
for this joint
Excelente
organization
juntar
of
nossos
this
esforços,
event. That
juntar
was
nossas
excellent
redes, nossos
to see
contactos,
these efforts, get these
nossas
networks
potências,
together.
buscamos
So
somar uno y uno más que dos, ¿no?
just to
Como buscamos
say that
sinergias
one
também, que é
equals
importante.
two, look for those
Agradecer
important
a todos os
synergies,
nossos panelistas aqui.
and
Jaime
to
Spin, que
thank
ajudou
for
a
our
brilhante
panelists.
mucho. ¿Cómo está, Jaime? Qué bueno verte.
Jaime, great to see
Alexandra
you.
Mata,
Alexandra Mata,
Nora Hiron, aqui de fundo,
Nora Hiron,
Juliana.
thank you, Juliana.
Todas com excelentes presentações.
And obviously
Así
with all this
que foi
for
realmente
your
uma
presentation.
jornada
So
excelente. Eu
it
não vou
was
falar
a
mais porque
really
nós
excellent
ficamos
day. I'm not
2
going
horas
to say anything else
depois
because
de
we
ser
are way over the time, so no
outras
problem.
atividades.
We have
Pero
to, I know you guys have to leave and do other
realmente
activities,
muito
but
agradecidos por isto,
we're just
todo o apoio
thankful
aí de
with you
Miguel,
for the support.
excelente moderação,
Miguel,
excelente.
excellent
Vamos a
moderation.
nombrarte
I think that
moderador
we're going to
oficial
appoint
para as
you
cerimônias de
the
todos os eventos.
official
Muito
master
Miguel.
of ceremonies
Muchas gracias
for
aí por
the
todo.
upcoming events.
Así que
So
les
thank
desejo
you, everyone,
fim de semana.
and
Aqueles que
just
estão nos
have
Estados
an excellent
Unidos,
weekend from
excelente
here in the
celebração
United
de Dia de
States.
Ação de Graças,
Again,
¿no?
for those of you who are in
Especial
America,
de
have a great
agradecimiento a
Thanksgiving,
las
y'all.
famílias. Y para los que no
Enjoy with your
están,
families.
que no tienen feriado esta
And
semana,
for
excelente
those
fin de
of you
semana,
who
resto de
have
semana también y buen
a
trabajo.
holiday weekend,
Así
have a
que
great weekend, a holiday
quedamos,
weekend, and if
quedamos en
not in Latin
contacto.
America,
Muchísimas
have a great
gracias.
weekend too.
Gracias a todos. Adiós.
Thank you,
Gracias.
everyone.
Hasta
Bye-bye.
luego.
Bye-bye.
Hasta luego.
Bye-bye, everyone.